We are back on MorningLine. Thanks for joining us live. We're talking, as you see on the screen there, I'm reading it, how to solve the home and community-based services caught in crisis here in Tennessee. Talking about it with us this morning is Grace Smith and Dr. Jim Powers. Jim's over at Vanderbilt, Tennessee Coalition for Better Aging. Grace Smith with the coalition, as well as Age Well Middle Tennessee. Thank you both for joining us. We had Joe that waited through the break. Let's take his phone call real quick before we continue our discussion. And Joe, good morning to you. Hi, Joe.
Good morning, Nick. Just listening to your guest and what you've added to it. the younger people and even the news media and stuff, they seem to expect that when you get elderly and you need help, they don't give you much. This HUD National, about all they're doing now is giving you a phone number, and if you call the number, you might get somebody to answer. Chances are you won't.
Yeah.
They'll say leave a message, and I'm gonna wait for my desk, and I'm on another call. And leave me a message and I'll return your call, which 99% of the time they won't call you back. But a lot of countries are set up to take care of the elderly. The United States, especially the states, back when TennCare started, the federal government offered to give them money to keep Medicaid going the way it was going, and our governor, no, we don't want to take the money. We'll just set up our own deal, which is TennCare, and it's been a failure from the get-go.
Well, hang tight on that. Let's just the larger picture, what Joe's talking about. I don't know how it compares perhaps to other countries, you two, but I mean, yeah, it's kind of sad because we're all, if we're lucky, going to grow old. And yet the old, I just wish they would really get organized. And I know that we've got, AARP, but it's like, that's a powerful voting bloc. And yet, it's almost like they're marginalized. And I say there because I'm not quite there yet, but I'm going to be old soon. I just don't get it in this country. It just doesn't seem like we give the elderly their due. I agree with Joe.
I agree with Joe, too. And Dr. Powers, I'll let you chime in. But I think one thing that COVID has shown us that I hope we can carry forward is that we need to prioritize the health and well-being of older adults. Yep. We are all aging. None of us, and hopefully we will all age. We can live long lives, but so this needs to be a we and us conversation to really bring this home. We do live in a society that values youth, and we have all these, procedures and products to help us stay young. Well, we need to reframe what it is to grow older, and that has many values to us individually and also to our community. Older adults are a valuable part of our community, and we want to stay engaged as we grow older. So I would agree with Joe. I think as a society, and certainly in America, we need to do more to really embrace aging and to support all of us as we grow older.
That's right. And I will add that what's good for older adults is actually good for society. It's good for families. It's good for everybody. And thinking ahead to the future for people that are younger, we want to make sure that society is ready to receive younger people as they get older. Do you know that the fastest growing group of elderly is the 85 and above? Wow. It's incredible.
Yeah.
And never before in human history have we had as many centenarians who are alive in the world today. We have almost 1 million centenarians in the United States. That's incredible. Never before in human history has that been possible. So we truly have to plan for aging and services to help support healthy aging.
Nick, the other
yeah.
thing I would add, just to
Sure.
echo what Dr. Powers is saying, is that we have this idea that once you retire, you don't do anything. Well, that is so far from the truth.
Yeah.
We helped start Senior Ride Nashville, and the majority of the volunteer drivers for that program are older adults. Older adults are vital to our community, and many are volunteering, staying active, continuing to work very often. And so we need to understand that older adults are a real value to our community.
No doubt. And to be able to function as you just described there and do these other things, you don't want to have to be worrying about where you're going to live and how you're going to pay for it. And I wonder, Grace, if you could share, have you seen through the Age Well Middle Tennessee or through the coalition any anecdotes about the situation, though, the dire situation sometimes that face these seniors when they are up against it and maybe at some point end up having no place to go?
That happens. What's happening more and more is we're seeing people outliving their resources, or the cost of housing has increased so much that people can no longer afford. They call Age Well Middle Tennessee. We do offer a helpline, and they frequently call looking for more affordable housing. And so we are looking at solutions like home sharing, where people, you can have a roommate. If you've got an extra room in your home, have a roommate come in to help pay some of your housing costs, and also offer companionship. There are ways that we can make it easier for people to afford to stay in their home, or also to qualify for services, but it's going to take a concerted effort of faith communities, nonprofits, government, private sector working together to create a stronger support system.
And Dr. Powers?
I'd like to comment.
Yeah, go for it. Yeah.
Yes, on what Joe had just mentioned,
Sure.
where you make a phone call, you don't get any response. We in Tennessee have one of the most restrictive policies for getting home and community-based services. We know that if we can provide home services to folks, that it is a great relief to their caregivers. For instance, if there's an Alzheimer's patient that's being cared for one at home, they can stay home another 2 years if that family gets some respite care, if that family gets some homemaker services. Those are not skilled things that Medicare can cover, but that we can cover as a state. And right now, Tennessee has a very restrictive policy. You have to be eligible for nursing home care to get these services. And that's just crazy. Why wait till then? Some people will be in the nursing home, where we can help avoid nursing home placement by keeping people in the home where they want to be, and use this $157 million creatively to help promote that.
Right. And again, that money's coming from the American Rescue Plan Act, right? So what will it take to get that money? And is that a one-time payment of money? How does that work out? I'm just not sure. The $157 million, once you get that, is that a one-time lump sum that comes, or is it something spread out over time?
It is spread out over 2 years. The services have to be provided by the end of 2024.
Okay.
So there is a timeline. And you're right, it's not continued funding. It is a one-time, basically a stimulus. And what we would like to advocate for is this to be used to create some new programs, some pilots, and to see what works, and maybe to form some public-private partnerships that might help individuals that could pay something, but not the full cost of care.
Okay. And so is there
Nick, one of the things
Go ahead.
One of the things, because that money is time limited, as we've talked to TennCare and shared the coalition's recommendations with them, we know that they are very cognizant of needing to use these dollars in a sustainable way, because it needs to be spent, as Dr. Powers said, by March of 2024. So that is something that the state is being mindful of. What we're concerned about is that those dollars are directed where it matters most. So it can help address the direct care workforce shortage, that it addresses support for family caregivers, and that it addresses preventive measures to keep people at home and out of nursing homes as long as possible. And there are creative ways to do that, but we want to make sure those dollars are applied where they're needed most.
Now, that makes perfect sense. And as always, it does come down to money. But certainly allowing someone to stay at home, okay, and just have someone visit once in a while is far cheaper than being in a nursing home. So it just makes perfect sense. And that's where they'd prefer to be as well. Listen, we'll take a break. We've got up against our next break. We'll come back. We've got more phone calls, more of our conversation with our TuneFind guests right after this. Stay with us.